So how do you get your child to open up to you? And how do you know what to say to your child? It's a difficult topic to discuss. How do you, as a parent, approach this? Even just some of the words we use can be judgmental, not intentionally, but can push your child away from you.
Right, absolutely. And it is really important to be mindful of language and the words that we use. Also important to not dismiss feelings that kids are coming with, even if we don't necessarily agree or understand them. Be very careful about not dismissing them. So you can start by just starting a conversation by saying things like, I noticed lately there's been a change, or you haven't been wanting to engage with this activity. How are you? What is going on? See if they are able to start sharing things. Then if they do share things, the first thing to do is to really reinforce. You want to say things like, I am so glad you're sharing this with me. I'm so glad you're telling me how you're feeling. This must be really hard for you. This must be scary or lonely. I'm so glad you're sharing with me so that I can be there for you and understand it and be there with you. Saying things like, it seems like you're feeling really bad and you're having a hard time knowing what to do next. Let's talk together about how we might work through your problem and work together on it. Those are things that will really help propel conversations forward and help kids feel comfortable and start coming out of their shell. And really, sometimes we don't even feel like reaching in because we're worried that we'll be rejected.
Yeah, or we won't know what to say when they really open up about their feelings.
Exactly.
We're not prepared.
Right. But a lot of the times, I think parents need to know they need to be okay with their own anxiety about that, because oftentimes it's not a solution that kids are looking for. It's just listening.
I notice you ask there a lot of open-ended questions.
Yeah, absolutely, which is really important. Starting with what you're noticing, sharing with them what you might be, concerned about really helps potentially open up a conversation, and then validating their feelings and really offering help, offering support, having them understand that you're there for them, that you want what's best for them, and that you might not agree with it, but you'll still always listen.
Should we be offering solutions? Like, I think you should do this and that and this and that, or it's better to listen and let them kind of come around?
I think first and foremost, listen. And then you can even ask, do you want me to help you with a solution? Do you need my help with this? Or what do you, especially if you have an adolescent who's, adolescents developmentally want autonomy. They want to be independent. They want to come up with as much of their solutions as they can, or as much of the control as they can. So really even asking, like, do you need my help? Do you want my suggestions? Do you want to hear how my experience was with a similar problem, or how I resolved it, or what I would do? And the answer might be no, and that's okay. And then you can say, can you want to share with me what your solution is gonna be? And really, it's important to find that balance between collaborating on a solution and just letting them know what they should do, because instinctively kids will say, no, I won't do what you're saying just because you're saying it.
Right.
That's their job as adolescents in a way. All kids need some control over decisions. When they're little, do you want to wear the red sweater or the blue sweater? And when they're big, it's about other things, but having them weigh in and setting limits. With certain things, you're going to have a rule as a parent, and there has to be a collaboration on having an agreement around that. But it's important to have a balance.
Right. So what are some of the things that we should never say, we should not say?
When it comes to suicide, there are, we do, and we hear it all over in media, social media, but saying things like committed suicide is really stigmatizing language. It really conveys that it's a crime that somebody committed. Saying things that somebody chose to kill themselves, or it was a successful suicide or an unsuccessful attempt, also just conveys the wrong message. So instead, saying things like, attempted suicide, somebody died by suicide, or there was a suicide death, those terms are really a lot more supportive to the complexity of deaths resulting from suicide. And they're really important to consider. Also, when kids are talking to us about various mental health issues that they're struggling with, saying things like, my daughter's schizophrenic, is again equating the person with the illness, and instead saying that they're living with schizophrenia or living with bipolar disorder, living with depression, it's a person with depression, is really just a lot more appropriate and helps break these negative stereotypes.